Good morning. Great to be here.
So let's start with the big question, and then we can kind of work our way down. Did the city of Shreveport really overpay medical premiums, insurance premiums to the tune of $30 million over 10 years? Are those numbers right? Did we do that?
That was the report that we initially received. I've received information subsequent to that conversation that suggests that that's not correct. So, no, based on what I've seen, I don't believe that we overpaid $30 million.
What is the number?
And how? Okay, look,
what is the number?
How much and how far back does it go?
The time frame you're discussing is correct. There was a discrepancy between what the city was paying and what an ordinance that the prior council put in place required, but the federal law governing the percentage of health insurance premiums that employers have to pay would have required us to pay more than the city ordinance, to my understanding. And so if you shake all that out, we didn't overpay as much as has been suggested.
So how much was it?
I don't know the answer to that question yet. I'm hoping that we get to the bottom of that eventually.
Let me ask you something, John. Was it a council that said that passed an ordinance that said we want to shoulder more of the cost of the health insurance rather than pass it on to the employee? Was it a benevolent move?
There was an ordinance in place that said that the city would pay a particular percentage, 70% of the cost of health insurance. And of course, when we talk about cost, we're talking about the overall cost of a self-funded plan.
If the city has a healthcare trust fund and you set aside money from your general fund to go into that to pay your portion, correct?
Yes, that is what the city has done.
And then you're supposed to pay 70%. But you ended up paying 85% or excess of 80%. And so that dwindled that healthcare trust fund down. Is that as simple as we can get it?
The city historically has not made sufficient payments to the healthcare trust fund to get it where it needs to be. It's really easy for administrations and councils to kick problems like this down the road. And although I don't agree with the way that this most recent set of premiums was rolled out by the administration, I do think that Mr. Whitehorn and Mayor Perkins deserve credit for addressing a problem that prior mayors and councils have not addressed.
Mr. John, I got a couple of questions here. So after talking to Mr. Grayson yesterday, I am a little bit confused. Question A, did the city of Shreveport overpay insurance premiums for city employees?
It's not overpaying, I think, is not the right word. Did the city of Shreveport pay more than was authorized by the ordinance that was in place? Yes, but it's not as though the money went out the door to some third party, right? This is all internal. So we're talking about how much money was how much of the cost of the overall healthcare cost was paid by the city versus was paid by employees.
Okay, so if we paid too much and we don't know how much it was over a decade, how do we find out?
The exercise would involve looking both at the city ordinance that was in place at the time and looking at applicable federal law and determining what we were required to pay by whichever of those two required us to pay more. So in other words, if federal law required us to pay more, but our city ordinance was out of line with that, the overpayment difference really is what were we paying versus what did federal law require us to pay.
Pardon me, Mr. John, I'm sorry. That's way over my head. Can you simplify that a little bit?
The Affordable Care Act, which was passed a number of years ago, requires certain minimum cost sharing by employers to be in compliance with that federal law. The Affordable Care Act requires the city of Shreveport, to my understanding, to pay more than the 70% referenced by our ordinance, which was passed before the Affordable
Would
Care
that have been 85%?
No, less than we have been paying. Everybody agrees that we paid more than both the city ordinance allowed and the Affordable Care Act required.
Okay.
So it's really, should somebody have noticed?
What about Gallagher?
Yes.
Should they have noticed this? Who should have found this out?
I think there is responsibility to go around. I believe that the city should have caught this discrepancy. I also believe that the city's health care consultant, Gallagher, should have caught it as well.
Is that money gone? Where did it go? Did it go to the insurance company? I mean, if we overpaid, the money had to go somewhere, and somebody has to have gotten it.
So look, again, we have a self-funded plan. Just for round numbers, say that the city's total cost in a given year was $10 million, okay? And the city bore 85% of that cost, $8.5 million, and employees bore in the aggregate $1.5 million. The money was paid to healthcare providers for the benefit of city employees. The money has not gone, and it's not gone to an insurance company because we are self-insured. So the issue is that year after year, we paid a greater share of the cost of healthcare for our self-funded plan than was authorized by a city ordinance, and also more than was required by the Affordable Care Act to be in compliance with that federal statute. So it's not a question of the money having been paid out to an insurance company.
Aaron and I are thinking the same thing. Then how is the healthcare trust fund broke?
It's not broke. It is, we have not been putting in sufficient money year after year to cover its costs. Part of the reason for that is that the city has continued to absorb the cost of increased health insurance rather than share that increased cost with employees. We've got to strike a balance between our obligation to take care of our employees, which of course is very important, and our obligation to be responsible with the public's money, which is also very important. And that's what the administration is attempting to do. The problem with the rollout, there was a memo that went out that said people would experience a 5% increase in premiums. And for some folks, the increase has been much more for the PPO plan. That caused the confusion.